This last week we concluded Nurses Week, and as a doctor, this is the story that I want to tell to say thank you to nurses in general, but one nurse in particular whose name I don't even remember. Reality is that medicine is a team effort, and that medicine would not continue to go forward and be successful in making advances without everybody working together as a team. The story that I want to tell is about the birth of my first daughter. Like every soon-to-be parent, you are terrified of anything that could go wrong, and I was in medical school at the time, and so I had a little bit of knowledge, but not enough to really understand everything that was going on. And so I had become acquainted with a lot of the possibilities of disaster lurking around every corner when it came to the pregnancy that would end up giving me my daughter. During this time, we became aware that my daughter was not growing well inside the womb. After about 32 weeks, her size just wasn't changing. She wasn't putting on weight. Everything looked great, but it became apparent that something was wrong and it would be better to have the delivery than to continue to wait till about the 40-week time of pregnancy. We were working with an OBGYN who was very knowledgeable, but to me didn't have a lot of personality. She was very serious and very just down to business. As a medical student who wanted to understand more about what was going on, she was, in my opinion, annoyed with the types of questions that I would ask, because a lot of it was probably coming from a place of ignorance, and I didn't recognize it at the time, but I felt often dismissed. Because we wanted to have the baby earlier due to the potential complications, we went into the hospital at about the 37-week plus 1 day mark and started the process of an induction with the hopes of a vaginal delivery. Now, if you're not familiar with what an induction looks like, if we are trying to have a vaginal delivery, they're going to start to give medicines to the mother to help induce labor. We're going to trick the body into thinking it's time to go into labor rather than letting that process happen naturally, which happens usually around 40 weeks. So at 37 weeks we went in and a medicine was placed against the cervix called Cervidil, which is supposed to help soften and relax the cervix so that it can begin to dilate, and that can induce some cramping and some contractions, and that process did start to happen. But when you really want things to move, it's often women are given by IV a drug called Pitocin, which stimulates contractions to occur. As the uterus contracts, the cervix continues to soften and dilate, and the body should be preparing for delivery. My wife had been in labor for most of the night and was pretty exhausted and uncomfortable, and things had been progressing okay, but what we started to notice as we got into the late morning and around noon the next day, we were starting to see something on the monitor called a late deceleration with every contraction. So the mother is hooked up to a monitor that measures the baby's heart rate, and we want to know what is the baby's heart rate doing in response to the contractions, because it's a stressful thing, obviously. And so when we see a contraction happen and the baby's heart rate starts to go down towards the end of that contraction, this is termed a late deceleration, and it is a sign of impending doom for the baby. It can be disastrous if the baby is not delivered quickly. My wife was still hooked up to the Pitocin at this time, and contractions were happening pretty regularly, and we were seeing consistently these late decelerations on the maternal fetal monitor. Now, I knew enough as a medical student that that was not good as I looked at the monitor, and the nurses were obviously starting to get concerned as well. As a result, they called in the doctor, and she came in, the same one that we'd been working with the whole time, and she took a look at the monitor and she said, "Let's go to C-section." She started ordering all the nurses to prepare everything to transfer my wife into the operating room so that we could do a C-section and get that baby out of there. I appreciate the decisive action to care for the baby, and I know that that was a decision that was made in her mind with the idea that it was going to be best for everybody involved. However, I really appreciate the fact that one of the nurses in the room went to the doctor and said, "Can we try turning off the Pitocin first?" The doctor was visibly frustrated and did consent to turn off the Pitocin and wait a few minutes to see what the response was. So the Pitocin drip was stopped, and we watched the next few contractions. They weren't quite as intense, and the late decelerations stopped because the contractions weren't coming quite as regularly. And then over the next 30 to 60 minutes, the body started to do what it needed to do, and my daughter was born there in that room without a C-section. And I'll never forget the look in the eyes of my daughter when they took her over to the little baby warmer to start wiping her down. She was so little. My daughter was born at 4 pounds 7 ounces, completely healthy, no time in the NICU. And when I made a connection with her eyes from across the room, it was like looking into my own soul. And that is an experience that I wouldn't have gotten if we had gone into having a C-section. And I will forever be grateful for that nurse who advocated for my wife and for my daughter in that moment and prevented a C-section that turned out to be not necessary. I know that's not the case in every situation, and that medical decisions can be complex. There's multiple factors that go into that, and decisions do have to be made on the fly. And I'm not even saying it would have been the wrong decision if that was what was needed in the moment, but I'm so grateful that we didn't have to go in that way, and that I had the experience of looking into my daughter's eyes the way that I did, that my wife was spared from a procedure that would have taken longer to recover from. And I can't thank enough whoever that nurse was that was in that room that day at the hospital in Des Moines, Iowa, who advocated for us. So this is my way of saying thank you to nurses who advocate for your patients each and every day, for doctors who are striving to provide the best quality of care, for physician assistants and nurse practitioners who also play a role in the care of patients in our complicated and not totally functional healthcare system. I appreciate everybody's contributions, and today especially, thank you to our nurses.